At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first Level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family. Greetings and welcome to our latest Let's Talk Your Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS, thank you for joining us. Health education is important because it empowers individuals with the knowledge and skills to make informed decisions about their well-being, leading to healthier lifestyles and improved overall health outcomes. So to help provide important education to community members on common health conditions, South Texas Health System hosts these monthly Let's Talk Your Health webinars. With this knowledge, hopefully we can help prevent, manage, and delay serious health issues in the communities we serve. Now, in this installment, we'll be talking about Parkinson's disease. Parkinson's is the second most common neurodegenerative condition in the United States per the National Institutes of Health, with an estimated 500,000 Americans having a confirmed diagnosis. An unpredictable and difficult illness, life with Parkinson's disease can be hard to imagine. Aside from motor symptoms like tremors, rigidity, and slow movement, people with Parkinson's may also experience sleep disorders, pain, fatigue, and depression. So what causes Parkinson's disease? Who's most at risk for the disorder? And how is it treated? Well, today we're joined by Abby Garza Leal, a doctor of occupational therapy with the STHS McAllen Outpatient Rehabilitation Center, with the answers. Abby, thank you so much for joining us.
Thank you for having me.
Now, you are a Parkinson's expert, so to speak, in the sense that you have been actually working with Parkinson's patients, and it all started as a volunteer with a support group about 7 years ago. Is that right?
Yes, that's correct.
So tell us about that experience.
Yeah, so I was at Texas A&M College Station for my undergraduate degree, and I was trying to receive prereqs for OT school, and I was trying to find hours, and an organization called Rock City Boxing in College Station was looking for volunteers, and they serve the Parkinson's community through exercise and boxing, and I showed up and I fell in love with it ever since.
Mm-hmm. And what was it about working with those patients with Parkinson's that really sparked your passion?
I think it was just getting to understand their story, understand where they were coming from, and understanding that their lives had changed, that they weren't the persons that they used to be, but now that they were living and learning how to cope with Parkinson's, and they were surrounded by others who also had Parkinson's disease as well.
And those support groups are so important because you do need that support system, and you do need to know that you can live well with Parkinson's, right?
Yes, of course. Yeah, it's super important, and I think that was the big takeaway I got from that group in College Station, is that the camaraderie they had, the support that they felt from one another, they were able to keep moving and keep going forward with this life-changing diagnosis.
Mm-hmm. Now, when you see patients that have Parkinson's, so you've been with STHS now for about 3 weeks, but you've been working with patients for a while now. When you see patients, are they coming in the earlier stages of a diagnosis, or are they coming in a little bit later when you may be a little bit more limited with what you can do to help?
Yeah, so it depends, but most of the time they are coming in at the later stages because diagnosing can take some time. So it would be great if we receive them in that stage 1, because then we can help manage and modify activities. But even if they do come in stage 2 or 3, we are still able to make it work. Though their symptoms are a little bit more progressed, we just learn how to modify and adapt with where they're currently at functionally.
Yeah. And we talk a lot about the importance of physical therapy and rehabilitation services after a stroke or a heart attack.
Exactly.
But with Parkinson's, it's the same thing, that if you can arm the individual with the tools they need to live a better, more quality life, then they can hopefully extend and manage, even prolong some of those symptoms from progressing faster. faster.
Yeah, exactly. Yeah, like physical therapy, occupational therapy, speech therapy, we can all play a part in someone with Parkinson's diagnosis, especially just in all the realms that they do. So PT can focus on strength and mobility, OT can focus on like the functional aspect of their daily life that's being impacted, and speech can focus on swallowing. And people with Parkinson's tend to have a lower voice, so they also work on like projecting the voice and making them speak at a tone that's more manageable to hear for others. Yeah.
And obviously education is key when it comes to any disease, and making sure that we give people the most information possible. And you have a great presentation for us, so let's get started.
Awesome, thank you. So we're going to start with the presentation about Parkinson's disease. So what is Parkinson's disease? So Parkinson's disease is a neurodegenerative disorder that affects the dopamine producing neurons in the brain, leading to challenges with movement, speech, and many other motor patterns. So it's typically marked with tremors, rigidity, and slow movement. This can also cause like unintended movements and uncontrollable movements like shaking and stiffness, which can be difficult for balance and coordination. And unfortunately with Parkinson's disease, it does worsen over time. It is a progressive disorder. So the causes of Parkinson's disease. So Parkinson's disease is caused by the impaired dopamine producing neurons. It also can be impacted because of the loss of norepinephrine. It's also caused by genetic factors, environmental factors, the presence of Lewy body disease. So that's more associated with like Alzheimer's and dementia. And then there's also like altered mitochondrial changes, and these can cause damage in the brains of individuals with Parkinson's disease. So the main causes of Parkinson's that we see is the loss of the impaired dopaminergic producing neurons, and the environmental factors as well. So some of the risk factors that people can have with Parkinson's disease. So a typical risk factor is age. Normally 65-year-old and older are diagnosed with Parkinson's. However, that does not mean you can't be diagnosed earlier in life. We tend to call that early diagnosis, or like an early onset of Parkinson's. Genetics can play a factor with Parkinson's disease as well. About 15% of Parkinson's disease diagnoses are actually tied back to genetics. Gender plays a factor, so men are more likely to develop the condition than women. As I can see just in patients I've seen, there are more men than women, but that doesn't mean women can't get it. And then exposure to toxins has also been an indicator of Parkinson's disease. So people who have been exposed to toxins, or even veterans who've been exposed to toxins during the war, have experienced some of these conditions with Parkinson's. So symptoms of Parkinson's disease. So symptoms of Parkinson's disease include tremors in the hands, arms, or legs, and the jaw or the head even. Muscle stiffness, where the muscle remains contracted for a long time, so we can also call that rigidity. It can be really hard for individuals with Parkinson's. When you ask them to even just sit upright and roll their shoulders back, they can feel a lot of stiffness just in that single movement. There's also a symptom of slowness of movement, which we call bradykinesia. So brady means slow, kinesia means movement, so slowness of movement. You'll probably hear that from your doctors when they're giving you symptoms. Impaired balance and coordination, which sometimes leads to falls. This is most of the time that can lead them to the therapy world, is when they have a fall at home and now they start needing to have services. Difficulty swallowing and chewing is another symptom. Mental and behavioral changes, which I don't know if people know that that's another symptom that can happen with Parkinson's disease. It doesn't impact your like non-motor skills or non-motor aspects such as your mental health, and depression does fall within that. You also tend to start having memory difficulties as you progress. Fatigue is a common symptom as well. And then symptoms also differ from person to person. I had an individual tell me at one point, it's like if you had a hat with all the symptoms in it and you drew 5, like every person has their own unique set of symptoms and it looks differently on everyone. And early symptoms can be subtle and they occur gradually. And also symptoms look different in everyone too when they're being diagnosed early on. So some warning signs. There are some things you can be aware of when you are wondering if you have a Parkinson's diagnosis. So something that people have noticed is cramped hands when they're writing or doing other fine motor tasks. Tremors that start in the hand, usually it starts on the one side, so it'll start unilaterally, as we say, or uncontrollable movements during sleep. Voice changes, so I was mentioning earlier that speech therapists work on like the projection of their voice. They'll tend to start talking in a really soft, monotoned voice. They tend to also have rigid facial expressions or facial masking. So if I ask someone to smile really big, facial masking means that they are having like a more serious face and no movement in those facial muscles. And also a stooped posture. Another early symptom that people start to notice is changes in their balance. So they start to notice that they trip over things that maybe they didn't before and things of that nature. So how is Parkinson's disease diagnosed? So Parkinson's disease is diagnosed by a physician, and the physician will inquire more about your medical history. They'll ask about symptoms you're currently having, and with that, they'll do the following neurological examinations and will conduct them as needed. And some doctors will do response to a drug treatment that can be an indicator if you are diagnosed with Parkinson's. So they'll administer a medication, see if your symptoms get better, and if that's the case, then that probably means you have the Parkinson's diagnosis. Again, when it comes to diagnosing, since I'm an occupational therapist, this doesn't fall under my scope, but I am able to educate on at least how it looks like when you are in those early stages and you're trying to find the answers you need. So this is typically the sequence you'll go through. You go to your doctor, they do the exams, and then they go on further to decide how to diagnose you further. So some treatment options we have for Parkinson's. So treatment is usually dictated by medication. So medication boosts or mimics and replaces that dopamine that we lose with those dopamine neurons that aren't producing the dopamine anymore to help treat the Parkinson's disease. There's also various surgical treatments. One of the more common surgical treatments that has to get approved by your neurologist is called deep brain stimulation. So it's called DBS. So essentially what happens is they put this little like monitor control in the brain, and then it has a little pacemaker, so it helps regulate the movements, and that gets done surgically. And there's also various forms of therapies that can relieve symptoms. So like we mentioned earlier, physical therapy, occupational therapy, and speech therapy, we all work together to help relieve the symptoms that a person with Parkinson's may face. So prevention tips. So I like to just kind of disclaim here that we can't necessarily prevent Parkinson's from happening, right? If you have Parkinson's, there's no way I can tell you that it's going to stop. We're going to prevent it. However, if there are some genetic factors impacting you that, let's say you have a family history, these are some tips that you can do to help yourself stay healthy and strong. So the first thing is exercise. So aerobic exercise has been linked to a lower risk of Parkinson's disease. It's really important to stay moving and stay healthy. And that's for all of us, right? But especially if you have some sort of genetic family history of it, exercise is important. Some studies have shown how caffeine and certain medications can also be linked to lowering the risk of the condition. Again, since I'm not a physician, I don't want to deep dive too much into this, but I think the main thing is moving our bodies, keeping each other healthy is one way to just limit any kind of progression of or getting Parkinson's. Okay.
Yeah, that is all really important information. And when we talk about Parkinson's disease globally, it's about 10 million people have it. Here in the US, we talked about 500,000 that have a diagnosis, but they expect that number to be closer to 1 million because of the difficulty, as you mentioned, of diagnosing it early. And it can be a little bit confusing with some of the symptoms mimicking other issues. Right. And then it is expected to double possibly by 2040 to 2 million people. So we are seeing an aging population in the United States. People are getting older and living longer, and so that means that threat of Parkinson's is going to impact more people. Yeah. So let's talk a little bit about that cause. So obviously there's really no known reason for a diagnosis of Parkinson's, but genetics is a main factor with about 10 to 15%, as you mentioned, of those cases. Yeah. So family history, when we talk about the importance of knowing your family history, it's really important to have those conversations with your relatives, right?
Yeah, yes, of course. Yeah, especially if you know you have some sort of family history of Parkinson's. It's really important that if you start noticing any different symptoms like imbalance or your handwriting or, like I said, the cramping, it's really important that you notify your doctor and you say, hey, I had a grandpa, I had a grandma that had Parkinson's disease. Is there any testing I can get done to, roll that out as something I have?
And then when we talk about environmental factors, what are those factors that are environmental?
So environmental factors is just being exposed to different kind of toxins. So those toxins haven't really been, at least I don't know the names of those toxins, but people who have been exposed, especially veterans across, like when they've been across the world, right? And some of these areas just have these toxins that aren't supposed to be in the air, aren't supposed to be exposed to. So that tends to put people at a higher risk for exposure. And even in the United States, there's been areas that have been exposed to different kinds of toxins, and people who have lived near those areas, whether it's like landfills or things of that nature, they have also been diagnosed with Parkinson's. Yeah.
So obviously Parkinson's is a brain disorder. So what happens to the brain cells with Parkinson's?
Yeah, so like I had mentioned earlier, there's different forms of Parkinson's, but the main one that a lot of individuals have is when they lose those dopamine producing neurons. So essentially what happens is dopamine helps us move the body, right? So let's say I'm trying to move my arm in this way, and I don't have those dopamine producing neurons. It can either cause that stiffness or even just like the slowness of the movement. So the brain has a hard time communicating without the dopamine receptors.
Can it be a little bit confusing to, when you talk about slowness of movement, as you get older, we tend to slow a little bit because, you know, we're a little weaker, we're not as strong as we used to be, our muscles aren't as strong. And so is it difficult to, to determine that is Parkinson's, or is it just a sign of aging?
Of course, I think it's really easy to get confused with certain symptoms like that, especially like stiffness, the rigidity, and the slowness of movement. But I've heard from patients with Parkinson's, they've noticed that even with the slowness of movement, it takes a lot of concentration to even do the movement. So I think if you're noticing even just, it takes you a lot more of a thought process to do a certain movement that was easier before. I think that can kind of maybe play a different part than just the aging, like, oh, I'm moving slower today. Yeah.
Now, the average age for a diagnosis of Parkinson's is between 60 and 65, they say. But again, about 1 in 10 people with Parkinson's will be 50 or younger. So it is a possibility that you could be diagnosed with Parkinson's at a younger age than 60 or 70, right?
Yes, yeah, we have a few clients, few patients, and they are under the age of 50 that are diagnosed with Parkinson's. So yeah, it's common. And like I said, they started noticing symptoms. They were like, this isn't normal, this isn't right, and they got diagnosed early on. So yeah, we call that early onset Parkinson's.
What's the youngest age that you've worked with in your career?
So in College Station, I had a 38-year-old that was diagnosed with Parkinson's. Yeah.
So this is something that should be really top of mind for everyone, especially if you do have a family history of Parkinson's. Now, how quickly, and I know we talk about how it's Parkinson's, the diagnosis and the progression can be different for anyone, but how quickly can it progress?
Again, it kind of depends from person to person, but it can, especially if you get diagnosed early on and you're able to get the medication that you need to help regulate your symptoms, sometimes the progression can plateau, but then there are times where the progression can progress really quickly. So I really can't say. I wish I could give you like an exact, like, oh, it takes 3 months, it takes 6 months, because unfortunately it's really different for everyone.
And it's individualized, like every case is different, and so you have to be paying attention. But I think that's why it's so important to have that relationship with your doctor, to see your doctor offer. And I know that here in the Rio Grande Valley, unfortunately, we have a lot of people that don't go to a doctor, don't see them often, but that is when they're able to catch those issues early and hopefully slow any type of progression if you can catch it early. Yeah,
so an advice that I have is that if you're experiencing any kind of new symptoms or any symptoms, you can keep like a symptom log. So essentially what that means is that you can maybe write the day of the week. So today's Tuesday, right? So you can write Tuesday, April 15th, I experienced, stiffness today. And then you can kind of keep track daily or weekly, so then you can know, okay, I am experiencing new symptoms and different symptoms than before. And then you can go to your doctor and say, hey, I'm noticing these new symptoms. If you've already been diagnosed, like, is there something we can do? Can we maybe manage my medications better and things of that nature?
We always talk about how having a log is so useful, because as a doctor, you go into the office, you see the doctor, they ask you, have you been noticing any changes, any differences? And if you have this log that you can go back and say, you know what, the last 2 months, I've noticed that I've had this issue recur over time, you're able to determine a little bit better than to try to remember, like, well, it was maybe last Friday, was it, you know what I mean?
Yeah,
Whereas
exactly.
at least you have a written record.
Exactly, and a lot of people also tend to start having a notice in their balance changes, so that's also really important to know, like, okay, did you have a fall, or did something different happen to maybe make you a little more eager to go see your doctor and get some changes or to get some clarification. Yeah.
Now, when we talk about the progression of Parkinson's, there are 4 stages of Parkinson's that tend to happen. And so obviously the first one, stage 1, it's mild and mainly on one side, correct?
Exactly, yeah. So it'll start off with symptoms are very mild, but they might notice like a tremor on the left or right hand side, weakness on that side. But again, they're still very functional. They're still able to, you know, we call them activities of daily living, right? So you're still able to feed yourself, bathe yourself, do the things that you normally do. You're still able to work, but you might notice just some impairments in just your balance, or just it's taking you longer to do some things.
And again, generally mild and restricted to one side for the most part.
Yes, exactly.
So then you get to stage 2, and it starts to affect both sides of the body, and it starts to impact those activities of daily living a little bit more than it used to before.
Yeah, exactly. So once people start noticing symptoms on bilateral sides, that typically tells them that they're in that stage 2. They'll start getting either a tremor on both sides, or they just start noting the weakness that they have on the right side. Let's say they notice it on the left side as well.
And then we get to stage 3, and this is when you start seeing those balance impairments becoming more noticeable.
Yes.
You also are still able to live independently, but you may need some assistance, like maybe a walker or a cane or a wheelchair, things like that.
Yeah, and that's also when sometimes you may notice them depending on their caregivers for more things that require more balance. So for example, like getting dressed, right? Like they might need help putting on like their pants, for example. And that's when in occupational therapy we come in and we teach them ways to adapt and modify, especially in that stage, so they can keep doing the things independently, right? But we're changing it on how they do it.
And then stage 4 is unable to stand or walk without assistance, and usually requires 24-hour care, and it usually also means you're in a wheelchair or in bed for most of the time.
Yeah, unfortunately, that stage 4 is when you're in that like total dependence on a caregiver, and you're pretty much either bed bound or in a wheelchair, and you're depending a lot on your caregiver at that point.
Now, what is the life expectancy for Parkinson's? Is it similar? Is it similar to just general population? It's just going to be quality of life impaired, but you're still going to live a longer life?
Yeah, so Parkinson's disease does not impact like how long you live. Again, it just impacts maybe your just functional ability to do the things that you enjoy doing and that you need to do. But typically individuals with Parkinson's still live their full life expectancy and everything like that.
And is it fatal?
No. So Parkinson's disease isn't fatal. So when you get that Parkinson's disease diagnosis, don't think like, you know, it's a fatal end all be all diagnosis, right? Like you're still able to live that life that you have, and you're still able to live that full life expectancy.
The biggest thing is catching it as early as possible to slow the progression, so that you're able to hopefully stop it as much as possible so that you can lead a fuller life for as long as possible.
Yeah, I always tell patients that like you know your body the best, and you're the person who knows everything about yourself. So if you're noticing differences in anything that you're doing, like I said, if you're noticing more stiffness, you're noticing a tremor, like, you know, that's something you need to bring up to your doctor. So like you said, just being educated and knowing like, okay, this isn't normal, my body doesn't normally move like this, and just, you know, catching it early.
And again, you know your body, you know when something doesn't feel right. And the thing is, if something doesn't feel right, go to your doctor. That's rule number 1. Now let's talk about those early symptoms, and I know you mentioned it, and I find it interesting that you mentioned one of the really early signs is that small handwriting, or that you start having difficulty with your handwriting, and I know I have neat handwriting, so if I notice that I'm either tired or sluggish, you know, when you notice, but if you start noticing your handwriting is looking a little different, a little smaller.
So typically individuals with Parkinson's, instead of having like nice big letters, right, they tend to get really small, and it it almost looks like scribble. Like they have a really hard time even just making like a fluid, like let's say I'm doing an A, right? Like it gets really difficult. So yeah, just changes in handwriting.
And then soft voice, which surprises me a little bit because I mean it's your vocal cords and
exactly.
all. So your voice, if you tend to speak louder, it's now you're gonna have a little bit of a softer voice.
Yeah. So like you said, the vocal cords, all of these muscles in your throat that help you speak, they're all muscles, right? So it gets impacted with Parkinson's, just like your arms and legs do. So typically what starts to happen is they start, instead of projecting really loud like how I am right now, they start to talk really soft like this and very monotone, like they don't really have a lot of expression in their voice either.
And it's not necessarily intentional, obviously.
Of course not.
You're not able to, you just can't.
Exactly.
And you can't.
Yeah, like, and a lot of the times they don't even realize that they're speaking really soft. So there's actually a program that speech therapists do it's called Leaf Silverman Voice Training, so LSVT loud, and they teach these individuals how to project their voice loudly.
Okay.
And with time it helps them, realize, oh, I am talking soft, let me talk a little bit louder. Yeah.
Another one of those early signs is dizziness. So I know dizziness is something that we really need to be paying attention to because it could also be a sign of a stroke or other issues, but dizziness is one of those early signs.
Yeah, so I mean, like I said, dizziness it can happen to anyone every day, right? But I guess if you're noticing it more frequently, or it's happening when you're doing something that you've normally never felt dizzy before, just be mindful of it, right? But I tend to don't want to scare people that saying dizziness is like a, don't think automatically it's Parkinson's, right? But just know that dizziness shouldn't be happening on the day-to-day.
And then a stooped posture. So your posture starts getting impacted. You can't really like fully sit up straight.
Yeah, so a typical posture that starts to happen, like you'll watch me in the camera, is that the shoulders will be hunched like this. They have the forward chin, so it's not like in like this. It's normally forward. And then even when they're standing, instead of being upright and tall, they tend to lean forward too.
Okay.
Yeah.
Now then you get into the symptoms that you start noticing in stage 1. So as you mentioned, there was those tremors. So it's just a little bit of the shake, basically.
Yeah, so essentially what starts to happen, so there's actually 2 forms of tremors. There's one called a resting tremor. So that means when you're seated or just standing, it starts to shake, right?
Okay.
And there's also something called an intentional tremor. So let's say I'm reaching for my cup, it starts to shake like this as I'm reaching for the cup. So either of those can start to happen with someone, but also sometimes people don't have tremors as a first symptom. Sometimes they start noticing the stiffness first, like, oh, I'm really stiff today. So rigidity can also be that problem.
That rigidity that you mentioned, that stiffness, then that slowness of movement that we talked about, and then obviously your balance and fall issues. And I think that's why it's really important because unfortunately as we get older, that risk of falls, and those falls are more dangerous when we're older.
Yes, exactly. Yeah, so if you're noticing any changes in your balance, it's good to catch it early before you have a serious fall, right? So if you're tripping over a rug or you're tripping over something that you've never noticed, right? Or even if you're just walking and you trip over your own feet, you're like, whoa. And I know it happens to us every day, right? Like we're busy people, we're in a hurry, but just know that if you're noticing it very frequently, like on the daily, like that's something to be aware of. Yeah.
And then when it comes to non-movement related symptoms, so low blood pressure, which I had a phone call today with a gentleman who has Parkinson's disease, and he said he started experiencing low blood pressure. That was one of the first signs that he had Parkinson's.
So it's called orthostatic hypotension. It can happen in other diagnoses other than Parkinson's, but individuals with Parkinson's do get impacted by it. So essentially what that means is when they come from like when they're laying down in bed and they come to sitting up, their blood pressure will drop. It normally drops, but it drops a lot. And then that's when they start feeling dizzy and lightheaded and they normally have to lay back down. So with people with Parkinson's, you really want to be sure that you check their blood pressure when they're coming in from laying down to sitting, and you give them a minute. You don't just bring them right back up, and you normally move them through the motions really slow, because when you move them too quick, the blood pressure drops really fast, and then that's when they start getting dizzy and maybe even fatigued and like maybe faint, and you don't want that.
And you don't want to fall either, like getting up so quick that then you fall. And then sleep issues. Like we talk about the importance of sleep, and we should be sleeping 7 to 9 hours, and I think for older Americans it's even 9 hours. We should be getting like 9 hours of sleep. But so if you start experiencing some sleep issues and they're inexplainable, that's another issue.
Yeah, so normally they'll wake up in the middle of the night, and there's also like, especially when you're already diagnosed, they have something called night terrors. It's where they have like these really terrible dreams, like they're almost like awakened and like they're just having these terrible nightmares essentially. And so that can also be a problem with Parkinson's. But yeah, if you're having sleep disturbances, like you're waking up a lot in the middle of the night, or you're having like insomnia where you're just not able to sleep, that can also be an indicator that there's something going on. Yeah.
Now we hear about vertigo. Is vertigo a symptom or a sign of Parkinson's possibly?
So I personally haven't worked with someone with vertigo and Parkinson's, but that doesn't mean that that person doesn't have that symptom, right? Like I said, it's kind of like you're picking all the symptoms out of a hat. So someone might be dealing with vertigo and Parkinson's, yeah.
And then we hear that constipation tends to be a problem with people with Parkinson's. Is it tend to be in the later stages, or is it you can have it at stage 1?
So I believe like bowel and bladder symptoms can start early in stage 1. However, when you start having more of the bladder issues like incontinence, that starts to happen later on in the stages. Yeah,
okay.
But definitely like constipation and changes in bowel movements can definitely be something in the earlier stages.
And again, you also talked on bladder problems. So being aware that bladder problems may be an issue as well.
Yeah.
So it may be a good opportunity to speak with a urologist as well, so that you're doing everything you can to keep and maintain your quality of life.
Yeah.
Now, so what kind of doctor would treat Parkinson's?
So typically a neurologist is someone who treats Parkinson's disease, and there are doctors called movement specialists. They treat people with neurodegenerative disorders that they're movement based. I would know people in College Station that would go see doctors like in the Houston area and stuff, and so they were a little more specialized. But typically here in the Rio Grande Valley, you'll be treated by a neurologist. Yeah.
And you will need to see your family medicine physician first, who will refer you. You can't just show up at a neurologist's office and say, hey, I think I have Parkinson's. You have to follow the proper channels, correct?
Yeah, so you'll get the referral from like, your family doctor, your primary care physician. They'll give you the referral to the neurologist. And then, the neurologist will do the needed testing that they need.
Now, when it comes to how often you should see your doctor, it says that it's about every 3 to 6 months. And that's because you're really paying attention to that progression, right?
Yeah, and that's why I think it's important to keep that symptom log if you can, because then you can tell your doctor, in the past 3 months I've been experiencing more stiffness, or more I haven't been able to sleep, or things of that, like that fall under that. And it is to keep track of the progression, to notice like, okay, are they hitting a plateau? Are they progressing, or are they just like maintaining, like I said, that plateau where they're at?
Now, you talked a little bit about the treatment options. So medication, obviously the medication is supposed to mimic or replace the dopamine. Is that right?
Yeah. Yeah, so essentially one of the common ones is called levodopa actually. And so that's essentially what it does. It's replacing the dopamine that's missing in the brain. And it really helps individuals with Parkinson's because it helps with the rigidity, it helps with the slowness of movement. It basically tries to get them back to like having typical movements again.
And then exercise is always really important. So you'll talk to your doctor, they'll tell you to do exercise. And then the other one is rehab. So then now we talk about your area of expertise. You are a doctor of occupational therapy, but let's talk first about physical therapy. So how, and obviously I think the physical therapist, the occupational therapist, and the speech therapist all are working together as a team to help the patient. But let's talk about, what is the physical therapist doing?
So typically from what I've seen, the physical therapist is looking at their gait, being sure that they can walk properly on their own or within a device, whether it's a walker or a cane. They're also looking at strengthening, right? With Parkinson's, unfortunately, we can't ever say like, oh, they're gonna go from lifting 30 pounds to 50 pounds, right? But we can say, okay, let's maintain them to lift that heavy or to do the things that they wanna do, right? So they'll be looking at their strength, their endurance, and just keeping them at that functional level so that they can ambulate in the home and do like get around at the grocery store and things like that.
And then you get into the occupational therapy, which is your bread and butter right there. And so occupational therapy, I think people always have that misconception that occupation means work, but occupations are your activities of daily living, as you mentioned, right?
So the way I like to explain it is anything that you do from the morning you get up to the time you go to sleep, that's an occupation. So getting dressed in the morning, brushing your teeth, feeding yourself, taking your kids to school, taking care of a pet, like any of that is an occupation. So occupational therapists, we focus on all those things. So if patient comes to us and they say, hey, I've been having problems with bathing and dressing. And I'm like, okay. And then we work with them to either adapt. So that means if now they need to get dressed in a seated position instead of standing, or taking a shower with like a shower chair instead of standing for safety, right? We look at all those components. Or if they say, oh, I'm still working, I would like to still work, like what can I do? We can teach them like energy conservation strategies, which means, you know, taking more breaks. So if you're like a teacher per se, like maybe you can do some lessons like seated and then you can stand and work with the kids or whatever the case may be, right? So we look at anything that they need help with that's in their daily life, and we help either adapt, modify, or just maintain their current level of function.
Yeah. And then you get into the speech therapy, and obviously we talked about the soft voice, so teaching them skills that will help them project more, and things like that.
Yeah, and also speech therapists also help them with swallowing. So people with Parkinson's tend to have a hard time swallowing like food and liquids, so speech therapy will help either modify their diet or their liquids to help them swallow safely so they don't have aspiration, which means liquid goes into the lungs, or food, right? Or they can just teach them how to strengthen the muscles so that they can still eat independently.
So can a person with Parkinson's still work full time? Are they, and because I know it, obviously it affects you cognitively, it affects your movement and stuff, but depending on the role you have, you should still be able to work, right?
Yeah, so especially if you're like in those earlier stages and you feel like you're able to do it, like I wouldn't discourage it. But if you are noticing problems in cognition, or if you're not feeling safe doing your job anymore, then it is best to, you know, decide to not work anymore. But if you're able to, you still feel cognitively aware, the fatigue isn't bothering you too much yet, then you should be safe enough to do that. Yeah.
And we talk about stages like 3 and 4 where you're going to need more assistance, but in terms of driving in the first stages, is it recommended in your early stages, stage 1, stage 2, that you can still drive safely?
Yeah, so again, it kind of depends, right, on the person, but typically individuals can still drive, but the neurologist will be the one to kind of tell them you're not allowed to drive anymore and kind of set those precautions. And then especially as therapists, we need to be aware, right? So if they're coming to therapy on their own, we're like, wait, you're not supposed to drive, right? So those will normally get set by the doctor.
Now, when we talk about exercise, so obviously we talked about rehab and what you need to do, who you can see a professional to help you with swallowing, with walking, with strength, things like that. But when it comes to exercise, we always talk about the importance of exercise. And I believe that people with Parkinson's or those who aren't really fully aware of it may think, I can't exercise. But in fact, you should actually work out more than you normally would. I think the weekly recommended amount is 1.5 hours, but Parkinson's Foundation says you should work out 2.5 hours, so 2.5 hours a week. So you should actually be increasing your exercise.
Yeah, and so when people hear the word exercise, they think, oh, I need to go lift weights at the gym, I need to go run on the treadmill, and that's not necessarily what it means, right? That means you can just go on a walk, or you can just, you know, do some light exercises like yoga and Tai Chi. So Tai Chi is actually known really well to work with Parkinson's. So again, since the slowness of movement, that Tai Chi really opens them up. It helps the rigidity, so does yoga. So just simple exercises like that people don't really necessarily think of. They hear exercise and they think, oh, I need to go run a marathon, right? No, that's not what we mean. We just mean moving your body. And always move your body safely, right? So if you're doing something and you don't feel good with your balance, do it in seated. There's chair yoga, there's Tai Chi that you can do in a chair. You can even do exercises seated in a chair, right? So just moving your body, it's really, really important.
Why is it so important for the body to move? The body was made to move, right?
Yeah, the body was made to move, and that's what helps the dopamine like move through the brain, and its movement is, you know, powered by dopamine, so it helps with all those symptoms that they experience.
So as you mentioned, Tai Chi is one of the ones, yoga. So you can basically look up some classes online. There's definitely a lot of yoga classes here. I know that you guys should really make it a permanent thing, but whenever we do community events, sometimes our rehab team will do some amazing Tai Chi classes, and people really appreciate it, but that's something that you can look into as well.
Yeah, and I also know that there's resources online, especially on YouTube. The Parkinson's Foundation will post exercise videos. It's mainly them that I've seen online that will post videos on YouTube. Yeah, so if you just look up like Parkinson's Foundation on YouTube, a whole list of different kind of exercises will pop up. There's even one called Power for Parkinson's. You just look them up on YouTube and there's a bunch of videos. They even have some in Spanish and English. They're more in English, but they do have some Spanish resources available. And they have some in standing and in sitting. So you have a wide variety.
So now I am curious, what is Power for Parkinson's exactly?
Yeah, so Power for Parkinson's is an organization. I think they're based out of Austin, but they post resources online that is free to the community. So I think that's a really great resource. So they post YouTube videos of basically their exercise classes. Yeah.
Now we talk a lot about fall prevention with older adults in general,
right.
But when you're talking about Parkinson's, that is really important because of those balance issues. So what are some of the things that we should be doing to prevent falls?
Yeah, so the biggest thing that I tell my patients is to avoid having clutter in your home. So meaning, like, you know, if you have rugs, I would get rid of the rugs. Not carpet. If you have carpet in your home, that's okay. But I mean, if you have flooring and then a rug, because then that you have a good chance of tripping over the rug.
Okay.
And if you have like excess clutter, like some people, you know, have clutter on the floor and things, like I would try to have everything free of, so your space is clear, right? And people also recommend, the research does too, having night lights. So if you have to get up to the bathroom at night, you have lighting like on the floor or even in your bathroom, so you don't trip and fall as you're going to the bathroom, right? Another thing too is, especially with Parkinson's, they tend to shuffle their feet, so that means they're not picking their feet up completely off the floor. So especially as therapists, we always recommend them to, like, we always tell them, like, think big, like do a big step. So really focusing on lifting the legs up and kind of almost like a march. It's gonna look and feel funny, but for them that's a normal, it's gonna help get their movement back to normal instead of the small, slow movements.
And paying close attention, obviously, to anywhere where there may be some drops. So like I know going from the house to going to into the house from the garage is one where I know I've twisted my ankle a couple of times. Thank goodness it wasn't too painful, but when you roll your ankle a little bit. So those places also paying attention
exactly there. So yeah, stairs can also be a big factor. So something that we recommend as therapists is sometimes you can get like highlighter yellow tape almost, and you can put it on the edge, or like neon pink, and you can put it on the step to help distinguish, like, okay, hey, there's going to be a drop, right? Or you can put it on where the step, so if this is the step, you can put it on the bottom so they can see, oh, a drop's going to come.
Yeah, so always paying attention to those surroundings.
Yeah, a big thing too is always scanning your environment. So don't try to look like, you know, straightforward, right? But always like looking down, looking to the side, being sure there's nothing in your way.
And paying attention to where you're going, because I know it becomes a habit for us to just walk and type or with our phones and while we're walking. So
I always tell individuals too, like, don't multitask, especially if you're walking or walking around in your home. Like, don't try to be typing on your phone and not looking where you're going. Avoiding multitasking can help with the balance, because it takes your brain a lot to multitask. Typically, we're not meant to multitask, but so for someone with Parkinson's, it already takes a lot of energy to think through a movement. So you don't want to be multitasking when you're already doing something that's requiring you to walk, because then you can lose your balance. So just focus on where you're going, and then, you know, do the activity once you're, you know, in standing and like steady.
And I know that you mentioned energy conservation. So doing taking those opportunities to take that moment to conserve your energy, so not necessarily pushing yourself all the way through, but just giving yourself some breaks to be able to rest.
So what tends to happen with people with Parkinson's is, with their medications, they have a period where they feel really good, right? So it's called an on period. So you're feeling really great, so they want to do everything. They're like, oh, I'm feeling good. I want to mow the lawn. I want to wash the dishes. I want to clean the house. But when that happens, once the medication wears off, they feel very fatigued and very tired. So what we recommend, especially as occupational therapists, even physical therapists will tell them to, you know, spread those activities throughout the week, like mow the lawn on Monday, on Tuesday, clean the house, and then on Wednesday, you know, do whatever chore you need to do, but don't try to do them all in one day. So that's really important with energy conservation. Or doing activities in a seated position versus standing. So let's say they like to cook, but it's, you know, takes a lot of energy to stand for an hour to cook a meal, right? So maybe you can do your meal prep sitting at the kitchen table. You can cut your vegetables or do whatever you need to do, and then you can stand to do the rest of the recipe. Yeah.
That is all really great advice. I feel like everyone should call the physical therapist's office and try to get an appointment just for a consultation, because there's so much great information and so much education that you all can provide.
Yeah.
Now, when it comes to special equipment, is there any recommended special equipment for people with Parkinson's, like a walker, a cane, any of those items?
So again, it depends on their condition, right? But normally physical therapists and the doctor will kind of recommend like mobility devices, so walkers and canes, wheelchairs of that nature. Occupational therapists, we can recommend certain adaptive equipment, so we can give them like a reacher. So what a reacher is it has a little like handle and the end has a little like grasp like this. And so like let's say they drop something, they can use the reacher to grab it, or we can give them a sock aid. So what that is it helps them put the sock so that they don't have to reach down themselves. It like puts the sock on for them, but they have to pull it up. But we can give them all kinds of adaptive equipment depending on what they need. Yeah.
And some of these pieces of equipment are actually covered by insurance, I believe.
Yes, they should be. Again, it depends on the insurance
and your plan and everything, but for the most part, you can get coverage.
Yeah. Yeah.
Now, you mentioned that you may experience some cramping in the legs and the toes. How can what is the best remedy to relieve that cramping?
Yeah, so when cramping starts to occur, so the best thing is to, like stop whatever you're doing and just take a moment. So sometimes the cramping can cause panic. So my advice is just to take a deep breath and just kind of, unfortunately, sometimes the cramp, you can stretch it out, but sometimes it can make the cramping worse. So my advice is just take deep breaths. And if you can stretch it out, I would stretch it out. So that's either, try and touch your toe, or if you're sitting, try to touch your toes and sitting. If you're getting a cramp like in your upper arm, trying to just like, open up the chest and get nice and big, right? But my advice is just try to relax, because what tends to happen is when we start to cramp, we panic or it starts to hurt. So then we tense up even more. So my advice is just to take a deep breath and relax. Yeah.
All right. Now, depression is a common problem when it comes to Parkinson's.
Yeah.
At least 60% of people with Parkinson's may experience mild or moderate depressive symptoms at some point during the disease. So talk about the impact on our mental health.
Yeah, so unfortunately, Parkinson's disease isn't, like you're getting a bar of chocolate, right? It is a hard disease to process, and it is something that can take a mental toll on the person that's diagnosed, but then also the family or their caregiver, right? So it kind of impacts everyone. So when that person feels like they're a burden, they don't feel motivation to do anything, or they're noticing, I can't do this anymore. I can't do that anymore. I can't do this, right? So it just really starts to eat them up. But my advice is just to always remember that, to get the help when you need it, be the advocate for yourself, right? Because especially sometimes in those earlier stages, right, maybe you don't have a full understanding of what's going on, but always advocate for yourself. If you need something, if you want something, be that advocate for yourself. So try not to tear yourself down, because just know that there's other people that are going through the same thing as you. You may not see it, you may not know someone with Parkinson's, but just know that you're not alone, okay? And, confide in people that you trust. So, your caregiver or friend or your brother, your sister, whoever. Find someone that you can rely on and they can be there for you. Yeah.
Now, can daily stress worsen Parkinson's symptoms? Can stress impact your symptoms?
Yeah, so when it's like us, right? If you're stressed, maybe you get a headache or you're feeling tight in your muscles, right? So the same thing happens with Parkinson's. So if you're feeling really overwhelmed or stressed out, yeah, your tremor might increase, or you might start feeling more stiff in the shoulders or your legs, wherever you experience your symptoms. So yeah, like trying to reduce your stress can really benefit you. So I know life is stressful, right? Things happen, but trying to limit it as much as you can really help alleviate those symptoms.
And we talk a lot about breathing techniques. So the speech therapist will work with you on some of those breathing techniques that you can do to just kind of slow the and hopefully stop the stress from getting too hard on you.
Yeah, and even physical therapists can teach them how to breathe properly during exercise, and even OTs, we can help them with stress relief techniques, and we can also teach them how to like identify triggers that stress them out and how to cope with those stressors that they may have.
Now, why is a support system so important? We're talking about all of these symptoms. We're talking about obviously in the later stages, but a support system from the beginning is really important.
Yeah, especially it's really important just because I said it's a life-changing diagnosis, right? Yes, you still have your full life expectancy, but you know, your life changes. You aren't able to do the things that you used to do. Things become more challenging. So if you can have someone to, you know, vent to, just be there for you, it can really make a difference. And you want to have someone who can even motivate you, right? You don't want to, I'm not saying that you don't want to have someone who's just going to, you know, mope with you, right? But you want to have someone who's going to push you to keep doing as much as you can for as long as you can. Yeah.
So what role can a family member play if they have someone in their family that has Parkinson's?
Yeah, so I guess my biggest advice is just, you know, be there for your partner, or if it's your brother, your sister, your mom, your dad, whoever it is, and just always understand that, you know, the things that are happening to them, or maybe the way that they treat you, because sometimes those mood disorders can kind of come in, the depression and stuff. My advice is always remember it's not always directed to you, right? So just always remember that they need you too, and I know you need them, but just always kind of work together. Communication is really important. So if they're communicating to you, like, don't brush it off, right? And if you're communicating to them, like, let them know that you're feeling things too. But my advice is, like, don't make them feel like bad for those things, right? Yeah.
Now, if I have a family history of Parkinson's disease, are there things, we know that obviously you can't prevent Parkinson's,
right?
And unfortunately there is no cure, but if I have a family history, are there steps that I can be taking now way in advance before I hit, you know, my 40s, 50s, 60s, to make sure that I can stay strong should I be impacted by it?
Yeah, like, I guess my general advice, even just for anyone, right, is just to stay healthy. Like, move your body, get the exercise you need, like you said, the 1.5 hours a week. Just staying healthy is a big factor, right? Trying to avoid getting any comorbidities, so like having heart disease and other problems like of that. Just keeping your body as healthy for as long as you can, so when, unfortunately, if that time does come and you do get that diagnosis, right, like, you're more in shape to fight it. And when I say fight it, I just mean like you're more strong and you're able to conquer it. Yeah.
Yeah. Early making sure that you're exercising is really important, and you're staying healthy. Prioritizing your health today will help you down the road.
Of course. Yeah, for anything. Yeah.
Now tell us a little bit about the support group. So there is a support group that the STHS McAllen Outpatient Rehabilitation Center launched earlier this year. Tell us about that support group.
Yeah, so we launched in February. We had our first support group meeting, and essentially I created that program during my occupational therapy program, so it laid out kind of like a year's worth of topics and discussions that we can have with the participants. So essentially we go over things that can help them manage their diagnosis. So we have fall prevention strategies, we have like a home safety checklist where they can go through their home and they can see, okay, is it safe for me to walk around the home? We have energy conservation techniques, medication management, because medication is very important, tips for sleep. I'm trying to think of the other things, just all these various topics that provide an educational resource, right? So if they're maybe not experiencing sleep problems yet, well, now they have a resource and they can be better prepared for when that time comes, right? But it also provides a area where there's other individuals with Parkinson's and they're going through similar things, and they're able to share advice. They're able to just maybe even vent to each other about, hey, like, this is happening to me, is it happening to you? And it provides, like I said, that like camaraderie, and they don't feel so alone, because like I said, it's really easy for them to feel by themselves and to feel like they have really no one, right? But with the support group, they're able to see, like, oh, hey, like, he has a tremor like me, or oh, hey, like, we're kind of in this together. Yeah.
You're Parkinson's warriors together.
Yeah, exactly.
And when are these meetings?
So the meetings are the third Tuesday of every month. They are at the McAllen, South Texas Health Systems in McAllen. They're on the first floor. We have them in the conference room. And they start at 11:30 and they go to about 12:30 in the afternoon.
All right, so it's a 1 hour session from 11:30 to 12:30, the third Tuesday of the month. So today's was one that was held, but you can go in May.
The next one will be May 20th, I believe. That should be the next third Tuesday, yeah.
And if they have any questions or need any more information, who can they call?
So they can call our outpatient rehab and they can get more information from there, and they'll be able to give them information about the support group. Yeah.
So all you have to do is visit South Texas Health System, McAllen.com. You'll see it on the website there. And you can also visit the STHS Facebook events page. Every one of those stroke support group meetings is listed in there. So make sure that you check it out as well, right?
Yes.
And you will get to see you every time.
Yes, me. I'll be there every single time. Yes.
All right. Well, thank you so much for your
You're
time.
welcome.
We really appreciate it.
Yes, thank you so much for having me. I really enjoyed it. Yeah.
All right. And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize your health and the health of your loved ones. We hope to see you for our next installment of this Let's Talk Your Health series on Tuesday, May 20th from 5:30 to 6:30 p.m. when we will discuss brain bleeds as part of Stroke Awareness Month. Like and follow the South Texas Health System Facebook page for more details on our future Let's Talk webinars. And if you'd like to see our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health. At South Texas Health System, the health of you and your family has always been our top priority. It inspires us to be among the nation's healthcare leaders. We're proud to be home to the Valley's first and only freestanding children's hospital, the state's first dedicated heart hospital, the first behavioral health facility with private inpatient treatment, and Hidalgo County's first level 2 trauma center. And we continue to transform healthcare, investing in advanced technologies and innovations to help you heal faster. It's that commitment to your health that has allowed South Texas Health System to build a reputation for excellence across 11 facilities, earning recognition for patient safety, cardiac care, robotic surgery, women's health, stroke care, and more. With our integrated network of nationally recognized facilities, freestanding emergency departments, physician practices, and outpatient centers, we are where you are, providing compassionate care and comprehensive services for you and your family.